for Obamacare coverage will soon see new price tags on those premiums.
The plans under the Affordable Care Act will be going up an average of 26% next year, and this marks one of the largest increases in more than a decade.
What happens when millions of Americans lose their health care right in the middle of winter? Not next year, not someday, but right now, as the Affordable Care Act hangs on by a thread. For families, older adults, and people living on the streets, this isn't politics, it's survival. One missed prescription, one untreated illness, one freezing night. And if the ACA falters even slightly, the impact will land fast. Let's be real for a moment. The government may have flipped the lights back on, but the deeper damage didn't magically disappear with it. The shutdown ended, sure, but for millions of Americans living paycheck to paycheck, it felt less like a political episode and more like a warning siren echoing through their lives. And now, with Congress bickering over whether to renew the Affordable Care Act subsidies, that warning is starting to sound a lot more like a countdown no one asked for. The stakes aren't small, they're harsh. If ACA support weakens or slips away, the first people to take the hit won't be the ones debating on cable news or writing op-eds. It will be the people waiting in crowded free clinic lobbies, the ones balancing two jobs just to survive, and the homeless in America who already depend on fragile access to care just to make it through another day. During those 43 days, community clinics saw waves of people skipping appointments, delaying treatment, and rationing medication because they weren't sure their coverage would survive the political storm. Outreach workers in shelters said infections got worse, prescriptions went unfilled, and fear spread faster than any official update. They weren't surprised. They felt the shift immediately. Because when the stability of healthcare wobbles, everything else in life starts to wobble too. One missed refill, one untreated infection, one freezing night without antibiotics. That's all it takes for things to unravel, especially for people living outdoors, couch surfing, or trying to keep steady work while holding on by their fingertips. These aren't distant hypotheticals. They're early signs of a system pushing past its breaking point. Meanwhile, in Washington, the debate sounds strangely detached from reality. Words like budget projections, subsidy structure, and long-term cost float around committee rooms like they're part of an academic lecture. But in neighborhoods still trying to recover from the shutdown's ripple effects, those terms translate into one simple, heavy question. Will I still be able to get help when something goes wrong? That's the real concern. Quiet, tense, and unsettling. Because every time the ACA is put on the chopping block, entire communities feel the shock. Not on spreadsheets, but in the choices people make to survive. Skip the appointment, split the pills, ignore the pain, hope nothing gets worse. This part of the story isn't about politics. It's about understanding how uncertainty itself becomes a burden. So before we move on, sit with this for a moment. If a shutdown can shake the system this violently, what happens when the law millions depend on is left dangling in limbo? Politics usually feels like something happening somewhere else. Arguments in Washington, loud debates on TV, disagreements that seem far removed from everyday life. Most people can ignore it, at least until it lands at their front door. But during the shutdown, that distance vanished almost instantly. The uncertainty surrounding the Affordable Care Act didn't stay trapped inside hearing rooms on Capitol Hill. It spilled into living rooms, clinic waiting areas, homeless shelters, and into the daily routines of millions trying to stay healthy and stable. Across community clinics in the Midwest, staff reported nearly a 20% drop in patient visits. Not because people suddenly felt great, but because they weren't sure if their coverage would still exist by the time the next bill showed up. A mother in Ohio skipped her asthma medication after overhearing someone say premiums might explode. Nothing had been confirmed. But fear, especially around healthcare, spreads long before the facts catch up. For someone with a steady home, that fear alone is enough to change habits. But for people experiencing homelessness, the impact lands with even more force. Shelters saw more people arrive with untreated wounds, spreading infections, and illnesses that could have been managed weeks earlier. At a mobile clinic in Colorado, one man quietly said, "If the ACA ends, I guess I just wait until it gets bad enough." He wasn't trying to be dramatic, he was being practical about the few options he had left. This is the point where politics becomes physical. Not through talking points, but through small, risky decisions, cutting pills in half, stretching insulin for an extra week, ignoring chest pain because one unexpected bill could wipe them out. These choices may look minor from outside, but for someone living with chronic illness or sleeping outside, they can turn a manageable issue into a crisis. Healthcare instability doesn't begin with hospitals shutting down or insurance markets collapsing. It starts with hesitation, a single moment of doubt, a choice to wait one more day. And those small delays build up fast, especially for people with no room for mistakes. This is the real cost of uncertainty. People begin adjusting their lives as if the system has already failed, even before any law officially changes. To understand why the Affordable Care Act suddenly exploded into the middle of this national storm, you have to look past the political arguments and into what the ACA has actually been holding together all these years. For more than a decade, it's been the quiet support beam of the American healthcare system. It doesn't get headlines, and most people don't think about it, but millions rely on it every single day. And when something that essential is put at risk, everything connected to it starts to shake. During the shutdown, lawmakers kept insisting their fights were just about budgets or short-term delays. But behind the curtain, the real battle centered on one question: would the enhanced ACA subsidies be renewed? Those subsidies are the reason health insurance is even remotely affordable for huge numbers of Americans. The second their future became uncertain, anxiety started spreading much faster than any official update. Here's the part that rarely gets said out loud. More than 15 million Americans use those subsidies to bring their premiums down. And about 60% of marketplace enrollees would see higher costs almost immediately if those subsidies vanished. That's not a small adjustment. That's a shockwave hitting households already squeezed by rising rent, food costs, and medical bills. And shockwaves never land the same for everyone. Insurance companies didn't wait for Congress to decide. They started preparing almost instantly. Some began reviewing whether they would need to pull plans from rural counties. Others started modeling premium increases in case the subsidies disappeared, even for a short period. Analysts warned that uncertainty itself could push insurers out of regions where choices are already slim. So when politicians say negotiations are still happening, here's what that actually means on the ground. A clinic in Minnesota wondering whether half their patients will stop coming in. A father in New Mexico trying to figure out if he can afford his son's insulin next month. A homeless outreach team in Portland preparing for more untreated infections as winter closes in. Because people don't wait for the final vote. They respond to uncertainty first. And no group feels that uncertainty more than the homeless in America. They rely on ACA-funded community health centers for basic care, blood pressure checks, wound cleaning, mental health visits, and the kind of treatment that keeps a small problem from becoming something dangerous. If subsidies weaken, those centers will face more people needing help, but fewer resources to care for them. One policy expert put it simply, if the ACA weakens, the system won't collapse, it will retreat. Retreats aren't loud. They happen piece by piece, but they leave people behind. And that's why the ACA is sitting at the heart of this storm, because so many lives rest on it, especially those already standing closest to the edge. When people ask what would actually happen if ACA subsidies weren't renewed, the answers don't fit neatly into campaign talking points or clean political sound bites. The reality is messier, heavier, and far more personal than most headlines ever show. Experts warn about 3 possible scenarios, and the truth is that none of them provide much comfort. The first is what policymakers politely describe as a soft landing. The phrase sounds harmless, almost soothing, but the outcome is anything but. In this situation, Congress drags the debate out for weeks or even months before eventually approving a late renewal. Technically, coverage survives, but the damage comes from the uncertainty itself. People cancel or delay appointments. Prescriptions go unfilled. Clinics watch their patient visits drop because people no longer trust that the system will be there tomorrow. It's a scenario built on hesitation instead of stability, and hesitation is rarely harmless. The second scenario is much more blunt. The subsidies simply expire. No grace period, no temporary bridge, just an abrupt ending. The market reacts within days. Premiums spike, deductibles stretch higher, plans shrink or disappear entirely. Insurers pull out of rural regions where profit margins were already thin. Families who depend on ACA support face impossible decisions: keep the insurance or keep the lights on, pay the rent or pay the premium. In this version of America, emergency rooms brace for more walk-ins, clinics tighten schedules, and households that have worked for years to stay steady find themselves slipping backward. But it's the third scenario, the one people hesitate to say out loud, that carries the heaviest weight. It's the scenario where the system doesn't just strain, it starts to give way. Experts call it a structural retreat, a slow slide in the wrong direction where essential services erode piece by piece. Not with dramatic announcements, but with quiet losses. A clinic cuts its hours, a provider exits the marketplace, a shelter loses the funding it relied on for basic medical outreach. And in this retreat, the people already closest to crisis, especially the homeless in America, feel the consequences first. For someone Without stable housing, a break in care isn't a minor inconvenience. It's a turning point. A wound that could have healed becomes a dangerous infection. A mild respiratory issue becomes a week in the ER. Winter cold intensifies every untreated condition. And the safety nets that once caught people start to fray under the weight. This scenario doesn't look like a dramatic collapse. It looks like access slowly drifting farther out of reach for the people who need it most. Which leaves one painful, simple question. How far can a healthcare system retreat before the most vulnerable have nothing left to fall back on? Every major policy fight creates pressure, but when the Affordable Care Act is the policy at risk, that pressure doesn't spread in a fair or even way. Some people might feel inconvenienced, others might feel disrupted, but there are certain groups for whom losing ACA support wouldn't just be hard, it would completely reshape their lives. The first group hit the hardest would be older Americans living with long-term health issues. Many depend on steady, predictable coverage to keep their blood pressure controlled, stay on heart medications, or manage diabetes day after day. When premiums climb or coverage becomes uncertain, those carefully built routines fall apart fast. For someone surviving on Social Security or a fixed retirement check, even a small cost increase can force heartbreaking choices. And chronic illnesses don't pause because Congress is arguing. They keep progressing, quietly and relentlessly. Next are the working class families who hold the country together. These are the people working overtime shifts, caring for kids, and stretching every dollar to make rent. For them, the ACA has never been a political issue. It's been the lifeline that keeps healthcare possible. If subsidies disappear, premiums could jump well past what their budgets can handle. That means skipped checkups, ignored symptoms, and a level of stress that spills into every corner of life: job performance, school, stability at home. But the group standing closest to real danger, the people with almost no margin left, are those without stable housing. The homeless in America already face constant exposure, broken sleep, and medical problems that escalate faster on the streets than anywhere else. For them, ACA-funded community clinics aren't a bonus. They are the only doorway into the healthcare system they can reliably count on. Take those clinics away or weaken their resources, and the fallout shows up immediately. Shelter staff say they'll see more severe infections, more uncontrolled chronic illness, more preventable emergencies. Outreach workers know exactly what happens when wound care programs or mobile medical units lose funding. Small injuries turn into infections. Treatable conditions become life-threatening. This isn't a theory. It's the pattern every time access tightens. The most vulnerable feel the shock first and feel it the hardest. So when lawmakers talk about necessary adjustments, they rarely acknowledge who absorbs those adjustments. It's not the people sitting in hearing rooms. It's the older adults choosing between groceries and medication, the working parents doing everything to stay above water, and the homeless in America who cannot survive one more layer of uncertainty. Because when the safety net weakens, it doesn't break at the top. It breaks at the bottom, where people have the least room left to fall. There's a pattern woven through American history. The warnings usually show up long before the crisis hits, but we rarely pay attention until the damage is already visible. And right now, The people who understand the healthcare system best, doctors, nurses, clinic managers, outreach teams, are all raising the same alarm. If ACA subsidies are allowed to lapse, we will see suffering that could have been prevented. This isn't a prediction or a political spin. It's a warning built on lived experience. Healthcare workers remember exactly what the system looked like before the ACA expanded access. Emergency rooms overflowing with problems that should have been treated earlier. Clinics forced to turn away patients they desperately wanted to help. Families splitting medication because they simply had no other option. They've seen how quickly progress can slide backward, especially during unstable moments like the weeks after the shutdown. And here's the uncomfortable reality. The system is already stretched thin. Rural clinics are shutting down faster than new ones open. Big city hospitals are short-staffed. Mental health lines are flooded. Outreach workers describe burnout unlike anything they've dealt with before. Take ACA stability out of that picture, even for a short time, and everything gets harder. People experiencing homelessness feel the strain first. The homeless in America depend heavily on ACA-funded community health centers for the most basic care, wound treatment, blood pressure checks, respiratory support. If those subsidies disappear, these clinics will be hit with more need and fewer resources. And the fallout won't be dramatic at first. It will be quiet, longer wait times, missed follow-ups, preventable conditions turning into crises. This isn't about ideology, it's about capacity. A healthcare system can bend under pressure, but it can't bend forever. So the real question isn't whether the warning is loud enough. It's whether we're finally willing to listen before another winter, another shutdown, or another coverage lapse pushes the most vulnerable even closer to the edge. Even with all the uncertainty surrounding the Affordable Care Act, the future isn't locked in place. There's still time to cut through confusion, protect access, and support the millions who depend on the ACA every single day. And the first step is surprisingly simple: clarity. During the shutdown, misinformation moved faster than any official communication, causing many patients to postpone appointments or stop taking their medications out of fear. Staying connected to reliable sources and helping others do the same can prevent a great deal of unnecessary harm. The next step is reinforcing the frontline. Community clinics, outreach programs, and mobile health teams are the first to feel the shock when the healthcare system becomes unstable. Supporting these providers through donations, volunteer work, or even spreading awareness keeps essential services available for the people with the fewest choices. When these clinics remain strong, small health issues stay manageable instead of spiraling into emergency. It also matters that our public conversations stay rooted in real human experiences instead of political divisions. The debate over the ACA isn't just about policy details or budget lines. It's about what happens when someone can't afford their medication or loses access to basic care. When we talk about real lives instead of political sides, finding common ground becomes far more possible. And through all of this, we can't forget who feels the impact most sharply. The older adult managing a chronic condition, the parent working multiple jobs to stay afloat, the person experiencing homelessness trying to get through winter with a treatable infection. These are the people standing closest to the edge. The decisions we make now, how we stay informed, how we respond, and how we support one another, will shape what comes next.